Hi, I'm Dr. Matu. Good to meet you, I'm Ali. What brings you in? I have anxiety and I want it gone. I can't do that. I thought you're an anxiety expert. I am. Okay, good. So please cure my anxiety. It doesn't work like that. I'm sorry, how much am I paying you for this? Nothing. The YouTube ads are subsidizing this. Okay, good. How long have you been experiencing anxiety? As long as I can remember. That's really common. Most people have anxiety for years before they come in for treatment. What brings you in now? It's getting harder and harder for me to leave my home and do all the stuff I have to do. Treating anxiety takes a lot of courage, so we need to hold on to that motivation, this idea of helping you to regain your independence. Hey, what's that? It's called an ADIS, a standardized interview for diagnosing anxiety disorders. How long is that gonna take? About 2 hours, but I'm going to edit this out so they don't see it. That makes sense, you gotta keep your watch time up for the YouTube algorithm. Since you're experiencing high levels of anxiety in a wide variety of different situations, you meet criteria for many anxiety disorders. Yeah, I know this. This is why I came to an anxiety clinic. Can you tell me why this is happening to me? I don't know. I'm sorry, what? About 30% of adults will experience an anxiety disorder in their lifetime. And for these individuals, genetics, environment, and experience all come together to create an anxiety disorder. That's really not a satisfying answer. Let me put it this way. Some of us are born with the volume turned up on anxiety, and some of us go through situations where our mind associates danger with an everyday task. And then some of us never really learn the skills we need to get through very anxiety-provoking situations. I like that explanation better. Then you're probably gonna like this one too. Anxiety is not your fault. And it is your responsibility to learn how to deal with it. Love it. Thanks, I stole it from one of my mentors. Thank you, Dr. Tim Verdine. Back to the important question, how do I get rid of my anxiety? Like I said earlier, you can't. You need anxiety. What? Anxiety helps you to prepare for important events and respond to danger. We need it. Without anxiety, I would never get anything done and probably would have been eaten by a bear or something. A bear? No, it's just an example anxiety therapists like to share. Like, if there was a bear on the loose and you didn't have anxiety, you would just stand there and get eaten by the bear. That's a terrifying example. You're right. I don't know why we use that. If you can't get rid of my anxiety, what can you do? I can help you understand anxiety, learn skills to manage it, and unlearn the anxious associations you've learned. Did you just paraphrase Yoda? Yes. He's the best. Agree I do, yes. We're gonna work together, just like Yoda and Luke, so that you're ready to be in the situations you want to be in. What about medications? For mild to moderate anxiety, either cognitive behavioral therapy or medications are effective in helping people to make progress on their goals. But if you have moderate to severe anxiety, you really need both. You need medication and you need cognitive behavioral therapy. Since your anxiety is in that gray zone of moderate, what we're gonna do is we're gonna give it a full dose of cognitive behavioral therapy, and let's see where we are a few weeks down the road. If you need medication to get more benefit from this, I'll make you a referral to a psychiatrist who can help you out with that. So how do we get started? Come back with 5 examples of anxiety from your week. I want to know what triggered it, what you experienced in your body, what popped up in your head, and how you dealt with it. That sounds like a lot of work. I thought we could just sort of sit here and talk it out. You and I only meet for 50 minutes a week. If you really want to make big changes in your life, you got to take this work that we're doing and apply it outside of these walls into your real life. And speaking of time, we're out of it. So I'll see you in a week. Thank you for watching the first episode of Real Therapist Fake Therapy.